What makes Parkinson's diagnosis hard to access? Imagine trying to solve a puzzle where some pieces are missing or look very similar to pieces from another puzzle. That's what diagnosing Parkinson's disease can feel like. It's a complex neurological condition, and pinpointing it isn't straightforward. One big reason is that there is no single test, like a blood test or scan, that can definitively confirm Parkinson's in every case. Doctors mainly relying on a patient's medical history and physical examination. But these assessments depend heavily on the experience of the clinician, and not everyone has access to specialists trained in movement disorders. In many parts of the world, especially rural or lower-income areas, neurologists with this expertise may be scarce, leading to delays or even misdiagnoses. Another challenge is that Parkinson's symptoms often overlap with other neurological conditions. For example, essential tremor, multiple system atrophy, or dementia with Lewy bodies can look very similar at first. Even experienced doctors sometimes find it tricky to tell them apart. There is a rule called the 1-year rule that helps differentiate Parkinson's from dementia with Lewy bodies, based on when cognitive symptoms appear relative to motor symptoms. But because symptoms can be so similar, this rule isn't always reliable, and initial diagnoses might change over time, sometimes years later. Imaging tests like dopamine transporter scans can support diagnosis by showing loss of dopamine-producing neurons in the brain. These scans can help rule out other conditions but are not perfect for confirming Parkinson's itself. They are also expensive and not always available everywhere. Plus, insurance coverage varies, which can make access even harder. These imaging tools are helpful but cannot replace the need for a clinical diagnosis based on symptoms and medical history. A further obstacle is that the most definitive confirmation of Parkinson's comes from an autopsy after death, when doctors can see Lewy bodies, protein deposits in the brain characteristic of the disease. Unfortunately, autopsies are rare, and most diagnoses are made while a person is alive. This means we often relying on clinical judgment, which can sometimes be inaccurate. Research is actively exploring biomarkers, measurable indicators like specific proteins in blood or cerebrospinal fluid, brain imaging markers, or even changes in the gut microbiome, that could help diagnose Parkinson's earlier and more accurately. Some promising candidates include alpha-synuclein, a protein linked to the disease, and neurofilament light chain, which indicates nerve damage. But these biomarkers are still in the research phase. They need more testing to confirm they work reliably across different populations and stages of the disease before they can be used widely in clinics. In summary, diagnosing Parkinson's disease is challenging because it depends on clinical judgment rather than a simple test. Symptoms can mimic other conditions, access to specialized doctors, and advanced imaging is uneven, and the gold standard of confirming with an autopsy is rarely performed. While ongoing research into biomarkers offers hope for easier and more accurate diagnosis in the future, these hurdles mean many people face delays, uncertainty, or even misdiagnosis. This highlights the importance of continued research, better training for healthcare providers, and efforts to make diagnostic tools more accessible worldwide. For patients and families, it's crucial to seek care from experienced professionals and stay informed about advances in diagnosis and treatment. The journey toward a more straightforward and accessible way to diagnose Parkinson's disease is ongoing, and the scientific community is actively working toward solutions that could change how this disease is identified and managed.